Welcome to Humanizing Healthcare, where we talk with innovators and thought leaders who are working to make healthcare experiences more compassionate and rewarding for all. Our host is Chris Malone, founder of Dallah Health and author of the award-winning book, The Human Brand: How We Relate to People, Products, and Companies.
Hi, I'm Chris Malone, and I'll be your host for today's episode of Humanizing Healthcare Live. We are here at the International Patient Experience Conference in Riyadh, Saudi Arabia. And I'm pleased to be joined today by Nabeel Oqbi, who is the Director of Patient Experience at Dallah Health. Welcome to the program.
Welcome, nice meeting you. Patient Experience Director of Dallah Health.
Excuse me, thank you for that correction. So, Nabeel, can you tell us if there is a story or experience you can share about how you chose a career in healthcare?
I did not choose healthcare. Healthcare chose me. My background is in quality assurance. I have a master in quality assurance, and I've been working in customer satisfaction for many years in different industry. And then I was proposed the job by Dallah Health as a patient experience director, which matches the customer satisfaction. So I joined Dallah 3+ years ago, and I'm doing my best to improve the patient experience and improving the patient journey within Dallah Health and improving the overall patient satisfaction in this area. Working in healthcare it's a gift from God, because as a part of a healthcare system, you are directly or indirectly involving in saving life, improving health of people. Just imagine, I imagine that patient is one of my family. It could be my father, my mother, one of my loved ones. So serving these people or serving patients, it's a pleasure by itself. So working in healthcare is a gift.
Well, you must have a really interesting perspective to bring because of your expertise and experience outside of healthcare, bringing that into healthcare. For folks who've only ever worked in healthcare, they may not have the full picture. And so I wonder if that has been helpful to you. Have you found that you are able to bring something different in terms of what you see and what the opportunities are?
Yes. Previously I worked in aviation, which is always also it's a big field of saving people's lives in the sky. Right. So the aspect of empathy and having focus on safety for the sake of people's health and safety it's a part of the whole journey. Bringing the expertise from a very high regulated industry as an aviation to another highly regulated industry as a healthcare, it both mixed and created a journey that saving people's life is a very important target that you can work for, and it's a pleasant. It give you peace, inner peace, that helping someone else, even if in a very minor details, shows them internally.
I'm sure it must make you feel that in aviation, it's important for someone to have a safe and successful trip, but there's nothing perhaps more meaningful and important than someone to have saved a life.
For sure. Yes, I totally agree with that.
And so Dallah Health, I understand, is a real leader in healthcare here in Saudi Arabia. What are some of the things that you are focused on from a patient experience standpoint? Anything you can share with us?
Yeah, sure. Improving the patient experience in general is one of the pillars for the Dallah Health strategy, the 5 years strategy, and it is one of the pillars of this strategy. So we're working on improving the patient engagement and digitalizing most of the patient touch points to enhance patient experience, and as well as reducing time, improving the patient journey itself, and overall enhancing the whole experience. To be honest, the experience as a patient is unpleasant experience. It is very hard to change something unpleasant to a satisfied journey. I believe the only pleasant journey is maternity. The only pleasant journey in hospitals for anyone is only maternity. Otherwise, patients and their loved ones, they are going through a hard time. So making this hard time go smoothly, this is our mission. Making them feel safe, important, and making them engage in the decisions, making their lives and their processes much less hassles. That is our aim, to improve the patient experience at all.
You make a very interesting point. Really only maternity and maybe preventive care are cases where we want to engage in that process.
Exactly.
But in most cases, we don't want to be a patient. We don't want to be ill. We know we need the care, but it's a process that we wouldn't have chosen to go through. So if we can make that better, that makes it that much more meaningful. And I wonder, as you digitize those experiences, what are some of the benefits that you have seen from making that experience more smooth?
Making things, some of the process as digitals, like self-check-in, self-payment, registration. This is shorten the journey itself, reducing the waiting time, giving the patient more control of their own on the process, making things easy and clear in one step, follow the other one. So reducing the human involvement in the let's call it the pre-visit. It's making things much better from the patient perspective. So having them the ability to make their own appointments, cancel it, change it, self-registration, payment online. So the first step they can do is just see the doctor or taking the vital signs. So eliminating all of these multiple processes to make it digital that they can do in advance, making their journey much shorter and much easier.
Good. And it takes a lot of those administrative tasks, perhaps off the weight or off the shoulders or the desk of your staff as well. Perhaps enables them to spend more time engaging with patients.
Yes.
Now, you've had a very interesting career and diverse in terms of industry sector, and there are many young and aspiring leaders here at this conference. I wonder, do you have any words of advice or wisdom that you would share with someone who wanted to follow a path like yours, become a director of patient experience in telehealth? Any advice?
The main advice I give is find your passion first, work on it, back it up with the career, believe in yourself, then you will find the way to go through your career much easier and much meaningful. If you believe that you are in the right place and you have a passion here, just work on it. Don't stop. Train yourself, improve your skills, focus on providing the best what you can, and then everything will go smooth.
Nabeel, thank you so much for joining us today. It's been a real pleasure to talk with you. You have some tremendous insights and experience that we really value. Thank you to our listeners as well. And be sure to join us for another episode of Humanizing Healthcare Live here from the International Patient Experience Congress in Riyadh, Saudi Arabia. We'll be talking to another healthcare leader and innovator. Please be sure to join us.
Thank you.
Thank you. A real pleasure to talk
Thank
to
you.
Thanks for listening today. If you enjoyed this episode of Humanizing Healthcare, please give it a rating, share it with others, and follow us at Dallah Health on LinkedIn. And make sure you join us next time as we share more insights from another inspiring healthcare leader and innovator.